The next 12 minutes or so may be the most important 12 minutes of your life. So make yourself comfortable and don't miss a single word of this. As far back as history records, people have been searching for a superior method of regaining and maintaining their health. Over 2,000 years ago, Hippocrates, the father of medicine, said, "In disease, always look to the spine first." It was not until the 19th century, however, that a scientific approach to the study of the spine was made. Marc's study and research was done by Daniel David Palmer. Out of this, the research, the present philosophy, science, and healing art of chiropractic was developed. In 1895, in Davenport, Iowa, D.D. Palmer gave the first scientific spinal adjustment, restoring Harvey Lillard's hearing after 17 years of deafness. This healing phenomenon developed into the healing science called chiropractic, meaning done by hand. In the short span of time since then, through the application of chiropractic, millions of people have regained their health after suffering nearly every disease known to man. To give you a better understanding of how the doctor of chiropractic can help you, let's take a few minutes and discuss it. To illustrate how the body functions, we will use Gray's Anatomy as our reference. Gray's Anatomy is the standard textbook in all colleges where anatomy is taught. The skeleton provides the bony framework of the body. It also provides protection of vital organs by forming a protective shell, so to speak. The skeleton, along with the muscles and ligaments which hold it together, gives the body shape and form. The nervous system is known as the master system. The chiropractic student spends the major portion of his time studying this master system of nerves. So dense is the network of nerve fibers throughout the body that if the skin and all other tissue were removed from around the mass of nerve fibers, the body would still remain in its usual form. The sequence of development of the organs in the unborn child bears a direct relation to the order of their importance. Their first recognizable structure to appear is the brain, spinal cord, and spinal nerves. The brain is the seat of all intelligence. Through the brain and nerve connections, the body is bound together into one coordinating unit in which all the body functions are maintained in normal range. The brain, as seen here, is divided into several parts, each having to do with a specific body function, whereby control is maintained over all muscular activity, such as breathing, heart action, overall body temperature, growth of the body from the unborn child to adulthood, the replacement and repair of damaged and worn-out cells, elimination of waste materials, and nutrition of the body cells. All of these functions are controlled by the brain. The nervous system also carries impressions to the brain from body organs, including specialized cells of sensation, such as those of sight, smell, hearing, taste, and touch. Pain is also transmitted over these fibers, which is the signal that there is something wrong. Spinal nerves arise from the spinal cord and pass through openings between each vertebrated body organs, controlling and coordinating their functions. Of course, the spine must be in normal alignment so that the spinal cord and nerves can pass unrestricted through the spine and its openings. The slightest misalignment of any vertebrae of the spine is known as vertebral subluxation. Vertebral subluxation causes disruption of brain control of body functions by interfering with nerves as they carry their messages from the various organs of the body to the brain, or by interfering with other nerves that carry messages from the brain to the various organs. Any such interference causes the organs to function improperly, leading to sickness and disease. As an example, should you be bothered with headaches, sinusitis, subabnormality of the eyes, or any discomfort in the area of the head and neck, we'll expect to find some abnormality in the top part of the spine called the cervical area. Or should you have symptoms affecting your arms, shoulders, heart, lungs, stomach, liver, and so forth, we would expect to find problems in this area of the spine, which is called the dorsal or thoracic area. Or should your symptoms be in the area of the colon, male or female organs, or the legs, such as the sciatica, we would expect to find some involvement in this area of the spine, which is called the lumbar area. This is another view of the brain, showing the brain stem, called the medulla. From this area, several of the so-called cranial nerves arise, and also the vagus nerve that we hear so much about in functional disorders, involving the heart, lungs, stomach, liver, intestines, kidneys, and other vital organs. The relationship of this most important area of the medulla to the first spinal vertebrae, called the atlas, is very significant. The medulla actually extends down in the bony ring that makes up the atlas vertebrae. Keep this in mind as we go on, and you will see how any deviation of this vertebrae from its normal position can cause altered function of any part of the body. Did you know that nerve fibers from the right side of the brain are responsible for the function on the left side of the body? The crossover of these nerves takes place in the brain stem. It can readily be seen how some disease process affecting just one side of the body can be caused by a simple displacement of the atlas, the first vertebrae of the spine. Remember now, it can also at the same time directly affect many of the cranial nerves, which are responsible for controlling and coordinating tissues of the head, as well as the vagus nerve and its extensive influence over the entire body. There are many incidents in our daily activities which can create subluxations of the vertebrae in our spine, such as falling or improper lifting. And with traffic conditions of today, the rear-end collision is a common occurrence, creating the so-called whiplash injury, which always affects the first vertebrae of the spine and the vital nerve structure to which it relates. This also explains the great variety of disease processes that occur after such an accident. In maintaining health, we should get lots of rest, eat a balanced diet, and get lots of exercise. The law of physiology says either we use it or we lose it. This is true of a muscle, a joint, or even our brain. The more it is used, the more it can be used. However, in maintaining health or in the attempt to regain our health, rest, good diet habits, and attempts at exercising will prove futile if a vertebrae of the spine is subluxated, interfering with nerves which affect the body's function. As an example, should a subluxation occur, interfering with nerves that control and coordinate the digestive system, eating the best food would not help restore your health. The laws of nature work but one way. Where there's a cause, there must be an effect, and when there's an effect, there must be a cause. As an example, should someone drop a rock on the hose leading to your lawn sprinkler and pinch the hose, water would not reach the edge of your lawn. The result would be a brown, diseased, and dying lawn at those edges. Now, on discovering this condition, you wouldn't put fertilizer on those brown, dying, and diseased edges, would you? You would, however, remove the rock that was pinching the hose, thus removing the cause. The chiropractic approach to restoring your health follows this same logic. That is, by correcting the subluxated vertebrae, causing the condition, not the hidden misproposition of putting fertilizer on it. Quite often, a patient experiences relief after the first chiropractic adjustment. But for complete recovery, time is required for nature to heal and repair the damage. Here again, we are much like the lawn we were just talking about. After taking the rock off the hose and allowing the water to flow, it'll be some time before the lawn is green again. Physiologists have chosen to call the spine the lifeline of the body. In essence, the doctor of chiropractic then is the specialist of the lifeline. As you journey back over the road from disease to health, getting the necessary chiropractic adjustments to correct the cause of your suffering, we are sure that the statement, specialist of the lifeline, will become more meaningful to you. You'll be like millions of others who have added years to life and life to years by regaining their health through chiropractic.